my name is Chelsea. I'm the Assistant Clinical Director here at Pinnacle Peak Recovery, and I'm trained in Accelerated Resolution Therapy, or ART. ART utilizes bilateral stimulation, and it allows clients to take a negative image or a distressing image or memory, typically related to trauma, but also this can be related to grief, anxiety, depression, and it allows the client to essentially reframe that and replace it with either a neutral or a positive image. It doesn't get rid of the memory completely. The memory is still there, the event still took place, but it allows the individual to replace this. For instance, if I have a negative association with a memory, instead of that negative association coming up whenever I think about it, I can replace that with a positive association. So now when I'm thinking about that time frame, I'm thinking about that event, I have a neutral or a positive image that comes to mind versus the initial negative. ART is similar to EMDR in that it uses bilateral stimulation. However, it's typically a lot faster than EMDR. So we can see results in as few as one single session, especially if a person only has one issue that they're trying to work on, one single trauma, one single grief. But it is something that we can continue to use with clients. So for clients who have multiple instances of trauma, they have multiple losses, this is something that we can use to address several issues over the course of multiple sessions. We can also utilize it for future potential triggers. So for instance, I recently worked with a client on addressing possible triggers in the future related to drugs and alcohol. So we're able to do something called a typical day scenario, where we imagine what that typical day would look like with triggers, with cravings, with urges, and then the client is able to reimagine that while utilizing bilateral stimulation without the triggers, without the cravings. They can imagine themselves using their coping skills so that in the future, when they are experiencing that event, that day-to-day activity that they were worried about, their brain is now telling them, no, remember, we used this coping skill. Or they're imagining, I'm gonna go for a walk instead of going to the bar.